are ready to introduce our very first guest of the night. I want to bring on right now Miss Helen from our Survivors Rock and Breast Cancer Constituent community. How you doing, Helen?
I'm doing good.
So great to see you, man. In December, we're all ready for the holidays, right?
Oh, yeah.
I'm excited to get to chat with you. I was telling Helen a couple of days ago that I don't like to know a lot about our guests when we have them on because I want to have a real conversation right here with you guys and learn about her at the same time as you all are. And that way we can have just a very candid conversation. So, the one thing that I do know about Helen is she is a fellow musician, which is super cool. I always love to meet breast cancer survivors who are also musicians. And are you playing with anybody right now, Helen?
No, I still have neuropathy in my fingers, so it's making guitar playing a little challenging. So,
Ugh, that's not fun at
so
all. Not fun at all.
hopefully.
Yeah, no kidding. Well, I wanted to start off, and I always like to start at the beginning. So at one point or another, you were diagnosed with breast cancer. Can you tell us exactly, Helen, what led up to that point?
It was August of 2019, and it was time for my annual exam, and I have a really good primary care provider that I've been seeing for years, and she happened to notice a lump in my breast. Well, and I've had a couple before, and so I wasn't terribly worried about it because in the past it had turned out to be nothing. But she seemed more concerned, and she also, was asking me about, was I tired? And I had been pretty tired that year. And just asked me a lot of other questions, and so she set me up for a diagnostic mammogram at Seattle Cancer Care Alliance, and I got in like within a week, and the day I went in they actually had me stay and do a biopsy.
Wow, that must
And
have been really scary.
yeah,
Yeah.
so they had a couple years before that, they had me do an ultrasound that same day, and it turned out just to be a cyst. But this time they did the ultrasound, and then they said, "Can you stay for a biopsy?" And I was like, "Uh-oh." And then while they were doing the um, ultrasound, the biopsy, I could sense a little bit of different the way they were talking to me than in the past. Because in the past they were like, "Oh, we're sure this is nothing," and this time they said, "Well, if this does turn out to be something, you're in the right place." So I
Wow.
was thinking, "Ooh,
Yeah.
okay."
Well, how old were you at this point?
55, and this was a couple years ago, and so I um, got the call 2 days later that I had invasive ductal carcinoma, but they didn't have the type yet. And because my primary care provider is now a part-time physician, she only works part-time. I told them to let me know um, instead of her, like what my cancer type was. And they forgot to do that, and they actually released it on my chart. And so I found out I had triple negative breast cancer by logging in, by getting an email about you have a test result, and I
Uh-huh.
logged in and read that. And, you
Whoa.
know, of course, you're like doing all the things in between when you're waiting that you're not supposed to do, like looking at Google.
Yeah, danger, right?
Yeah, you're thinking, and I'm sitting there thinking to myself, well, I hope it's anything but triple negative. And then and the day I found out was the day of the Rolling Stones concert that I was going to with my husband. And I'd never seen the Rolling Stones before, and I was just devastated. I was just like, oh my God, I can't do this.
Yeah, no kidding. Wow, that's
But
terrifying.
yeah.
Yeah, and I should have told everybody off the start there that we're based in Dallas, Texas, and you're in Seattle,
I'm
and
in Seattle,
that's
yeah.
something that's cool about our group, our Facebook group, breast cancer, Private Rock Breast Cancer Constituent Community, is that you can be anywhere, and we have this little community together and help each other out, and we can meet like this and have you on the show, and it's as if you're in the same spot. So it's really nice. But okay, sorry, I little rabbit trail there. But okay, so you find out you have triple negative breast cancer. How soon after that were you able to like get and sit with your doctor and talk more about it?
It happened fairly quickly. And what they do at Seattle Cancer Care is they set you up with a whole team, which is an oncologist, radiologist, and a surgeon. And they had me meet I believe I met the surgeon first, but then the oncology team. And they also had me do genetic typing or a genetic test because of the type. Triple negative has a propensity to have a lot of BRCA positive people. And we do have a lot of cancer in my family, so they wanted to test for that. My mother has breast cancer, but she had estrogen positive. So, um, you know, neither she or I had even heard of triple negative
Yeah, that's
before I got it.
interesting. I was
Yeah,
gonna ask you that is what type she had, and it's interesting that she didn't have the same type as you.
yeah.
Yeah,
It's something that a lot of people don't even know exists. And
yeah,
sometimes they think it sounds good because you're saying, oh, it's triple negative. Like it's negative for a lot
yeah.
of stuff.
Right, right. Yeah, no, triple negative as in negative is bad.
Yeah.
Yeah, it's crazy.
So yeah, it was the whole month of August was kind of a blur because that my treatment started at the end of the month. I quickly met my, team. I did not meet radiology because that was just too much for me, and I knew that was going to be the last thing I did. And I was thinking, I asked them, I said, do I really have to meet them now? Because, you're processing like surgery and chemo and all this stuff. And plus I'm waiting on my genetic testing, and it was just a lot. you
Yeah,
know?
yeah, that is a lot. Well, did they at this point had they kind of told you what their plan was for you as far as surgery and treatment went?
Yeah, I was lucky in that it was caught early, and it was, from what they could tell, they believed it was, well, almost all of triple negative is grade 3 because it's faster growing than the other types of breast cancer, but it was um, stage 1. So fortunately, it was caught early. And of course, they wouldn't know about lymph node involvement and all that until we got to surgery.
Right, right.
But my oncologist was great, and she's a specialist in triple negative, and she does clinical trials, and she speaks at I've seen her name pop up on a lot of conferences for triple negative. And the first thing she did when she met was give me a big hug, which was
Oh,
really sweet.
man, I'm telling you, Helen, it's so crazy because your diagnosis, your doctor, everything is like right in line with me. I was stage 1, grade 3, and my oncologist also does clinical trials, and she speaks
Oh,
and does stuff
great.
too. I bet you they know each other. We'll have to talk offline and exchange details about that. But Dr. Joyce O'Shaughnessy, who does our Fact or Fiction that we play right before you came on, that's my doctor. So, well,
Oh, wow.
she was my doctor. She gave me up a few years ago, so I'm in the free and clear. But anyway, continue. This is great. I mean, so you've met her. She's fantastic. You love her. She's obviously very skilled and knowledgeable in her role as a breast cancer oncologist.
Yeah, and I mean, it just really set my mind at ease. Like the days before you actually go in and start talking about it are kind of the worst because you don't know what you're in for, and your mind's just kind of going to dark places that you don't want to.
Oh yeah.
But she was able to tell me that, even though this is a fast growing breast cancer as a whole grows slower than other cancer types. So that kind of put my mind at ease. So, it wasn't like, oh my God, you've got to get your surgery like tomorrow,
Right, right.
So, and then she explained to me why we did chemo first and why she wanted to do that. And part of it is because of her background in doing clinical trials. They like to see if the chemo they're giving you is actually having an effect. Whereas if you were to have surgery first and take it out and then they hit you with chemo, they would have no idea if it actually shrunk your tumor or not.
You know,
And
I've
so,
I've I've heard a couple of people say that. I've never had a my doctors tell me that, but that doesn't mean anything. You have so many conversations with your doctors, but it's interesting. I've heard a few people say that before.
Yeah, and that made sense to me because how would they know if they hit you with chemo? And I guess, they also want to see if it'll shrink any. And mine was fairly small. I think mine was 2 centimeters. But they definitely do it with larger tumors just to shrink them before surgery as well. So that's another reason to do it. But I was lucky because I started with the AC that they call the red, what do they call it? The red devil. But I,
Yep,
I
yep.
decided to call it Red Sonia. I thought
That's
that was better.
sounds a little nicer.
Yeah, yeah. And plus she kicks ass, so
There you go. That's nice. Amazing.
So we started that, and most of the chemo that I got was on Saturdays because they're pretty much open 7 days a week at SCCA. And I was really lucky that my treatment started pre-pandemic because I actually could bring people with me. And my friend Trish is watching the broadcast, and she was one of the first people to join me. My husband came to all of them, but we always had a friend with us. And so it was actually kind of fun. Like we'd post things on Instagram, and I actually had one person tell me, they go, "You kind of make chemo look fun."
That's not easy to do either, but
No,
I
it's
know what you're saying. It's sort of like, I guess just to be real about it is honestly getting chemo isn't fun at all, of course,
no,
but you try to
not
make
at
the
all.
best of a bad situation, is what you do is you kind of just get into that mode of, this is what I'm stuck doing for the next X amount of hours. I can either just sit here and wallow in it or I can try to make the best of it. And certainly for me too, Helen, having friends there made a huge difference in how I felt, when I was there and how I felt when I left. And it was possible to somehow make it fun. So, what did you guys do to make it fun? Were you like bringing games, or what did you do? You did like grab
Um,
surgical gloves, blow them up, and start a volleyball tournament, or what?
no, we just had a lot of really great conversations because it was, a lot of times you don't really see people, and like we kind of both me and my husband were working full time, and we'd basically go, and most of our socializing was going to see bands and things like that. And a lot of times you're not really talking when you're doing that, or you're yelling, because you can't hear anybody.
Right.
And so it was just kind of nice to have these like couple hours where you just sit there and kind of shoot the breeze and try to make each other laugh, and just kind of reconnect in some respects. Some people that came by were people I'd only been seeing on Facebook, so it was really nice to see them in person. And it
Were
was
you
just, oh,
were
go
you
ahead.
were you allowed to have more than one guest up there to
Yeah,
hang out with you?
yeah, we could actually bring, I think, three,
That's
up
so
to
unfair, man. I had my chemo like 10 years ago, way before. Yeah, I mean, I know yours is before the pandemic too, but like I was only ever allowed one person with me. So I'm
I
jealous.
actually saw one lady had her dog with her.
Nice. That's
I was like,
crazy.
where do I get the dog?
Well, did you have in your chemo? Cause some people watching maybe have never experienced chemo, and like for me, there were times where my chemo was in like a big open room, and they had almost all these kind of like pedicure chairs, right, with the heaters and the massage things and all that stuff. So they were all over in this giant room. But there were a couple of times where I ended up in a private room. It wasn't because I needed it; it's just that's just what they had. So they put me in a private room, and so it had a door and everything, and you weren't out in the middle of the open. What was your chemo treatment facility like?
So they have the whole floor. The sixth floor is all chemo. I think it was the sixth or the fifth. It's all chemo, and it's all private rooms, every single one of them. But some of them had beds and some of them had chairs. And I would always try to ask for a bed because it was way more comfortable. The chairs were kind of, the rooms were smaller, and then if we had a guest besides my husband, there wasn't a whole lot of room. So you know that was it was just like comfort. And I also was having so at Seattle Cancer Care Alliance, they give you what they call pre-meds when you go on Taxol, like you have your first 4 infusions of the AC. And I actually did great on that, which is the one that people usually don't do well on.
Yeah, I
But
didn't
when
know
I
about that.
yeah, the Taxol really kicked my butt.
Really?
And yeah, and I had an allergic reaction to it like
Ew.
3 infusions in. So usually, so they give you these pre-meds the first like 2 or 3 times. And I didn't have a reaction until like the third or fourth one when they stopped the pre-meds. And the pre-meds were all of like Benadryl and
Right,
stuff like that.
steroids and everything.
Yeah.
Yeah.
And so the first day they didn't give me pre-meds, I got like a huge rash immediately on my chest. They were like, okay, back to pre-meds with you. So
Wow.
that's kind of why I preferred the beds. Oh, and I also had fun with my port during that time. I don't know if a lot of people know when you get chemo, they give you a port. It's mine was installed here, and it's just so that they don't, because they have to stick you so much, and then they don't want chemo running through your arm and going to your heart. They want it to be close to your heart, which sounds weird, but when you think about it, it's because the heart will push the chemo out very quickly. Whereas if it went in your arm, it's kind of going all the way through a vein, then to your heart. So it's a more efficient way to get it through, and it minimizes damage to your body. And gosh, I've lost my train of thought now.
No, I was like listening to you and I was like, I never really thought about like why they put the port where they put it, you know. But
Yeah,
that's
yeah.
valid. Yeah. Yeah.
But
You said you had a lot of fun with your port, so
oh
that's
yeah,
awesome.
so I lost a bunch of weight when I was on chemo, and of course I've gained it all back now with the pandemic and then some. But because of that, it shifted, like it moved a little bit. So they were having a hard time getting a blood return. So sometimes they'd have to try to turn me upside down, like move the chair sort of so your head's way down here. um, they'd have you put your arm up, or try all these different things to get a blood return, because if they couldn't get the blood to come out, they couldn't give you your infusion. So that was happening every infusion towards the end, like the last half of my infusions. So
Gosh,
as
what a
soon as I
pain.
as soon as I was able to get it out, I got it out, because when I went in for my lumpectomy then, which is what everyone recommended for me, and I agreed as well, because that's the other thing you have to decide, do I want to do a mastectomy, do I want to, lumpectomy? And all the experts were agreeing that the best course for me was lumpectomy, but my doctor wanted me to keep the port in just in case, they didn't get all the cancer out. But I told her it had moved, and I told her about all the fun I was having trying to get blood.
Yeah, yeah, and
And
it's
she said, yeah, take it out.
well, it's funny because I mean, there's a conversation happening over on our Facebook group right now in the Survivors Rock Breast Cancer Constituent community about somebody who's had a lot of trouble with the blood return from their port, and it's it happens. It just happens. It can be a total pain. So yeah,
Oh
that's an
yeah.
actual problem. Well, so when you were going through all this chemo, Helen, did you lose your hair? What kind of side effects were you experiencing?
Yeah, I had hair down to here, and it was straight. Now it's curly. And a friend of mine who's my hairdresser came over to my house and gave me a cute short haircut, like about was it right after my first infusion? It was near my first infusion. So we thought that maybe I'd have this haircut for about 3 weeks. And a week later, I pretty much had my husband shave my head, because I don't know if this happened to you, but my scalp got really angry. Like it just hurt.
Yeah,
And
no, that happened to
yeah,
me too. Like right before it almost feels like the way I describe it to people is like if you have your hair like in a ponytail and somebody comes up and pulls your hair and then they let go, that kind of pain in your scalp that you feel, it felt just like that, like somebody was pulling my hair.
yeah, that's a good description, because
Yeah.
I couldn't really describe it to some people, but I had noticed after the first infusion, a few days after when I was washing my hair, that there was some hair coming out of my hands. And then the pain started, and I was just like, okay, I can't do this. I picked a day and I told my husband, okay, head shaving day.
Yeah, you just have to jump in there, don't you? It's like I gotta
hmm
gotta do it. So, how long ago? You said you were 55 when you were diagnosed. So, how long ago was that from now? Like, how old are you now?
About 2 years ago.
Gotcha.
So, yeah, my treatments ended last May. And so I've only been, I guess you count your survivorship, I think, from the end of treatment. Is
Um,
that right?
I do mine from the day I had my surgery because that was the last time they detected cancer in my body. So I do
Yeah,
the surgery date is what I do, but everybody's do whatever you want.
yeah. So I'm still, just a year out, really, from year and a half out from that. So my hair started growing back probably around April, May of last year.
Do you recall side effects being worse for the adriamycin cytoxin, aka the Red Devil, Red Sonja? Do you recall it being worse for that than with Taxol, or the other way around? Do you recall?
Yeah, Taxol was worse for me. I did the thing where you can get cold compresses for your hands and your feet for Taxol because neuropathy is a side effect. I still got it. So I've got numb toes and my fingertips are still numb.
Oh, that's
So
terrible. Yeah, and you did like all the icing. Like, I have a lot of friends who did that where they have their fingers. And to be honest with you, I think I'd rather have neuropathy than be cold. Like cold for me is so freaking painful. But that wasn't a thing 10 years ago. They weren't doing the icing thing, like the cold cap and the icing your hand and all that. That wasn't even a conversation 10 years ago. So I find it super interesting. I did have neuropathy myself as well, but it did not stick like what yours has. Do they have you on any kind of medication to this day?
just taking B complex, and recently my primary care provider put me on some magnesium. And I can't remember which one it is. It's supposed to help. Like if you take B complex and magnesium, it's supposed to help with kind of your nerves and the connections in between them. And it is feeling somewhat better. And I know that if I start being a little more active too, that might help as well.
Yeah, yeah, totally. So they never had you take gabapentin?
They keep recommending that, and I don't know. I mean, I took gabapentin for like shingles a few
Gotcha.
years
Uh-huh.
ago, and I don't know. I don't like to take a lot of
Oh
pain
yeah.
medications if
Yeah,
I
or
don't
just
have.
or just medications in general. I'm totally with you on that. Um so I know we still have a lot of ground to cover and we only have about 5 more minutes left in our time if you can believe it. Like I've enjoyed chatting with you about all this stuff. But I was curious, did your doctor go over preventative measures that you can take to prevent recurrence?
Um, basically, the main thing they say is just to get active and try to control your weight, and those are two things I've been really struggling with um over the pandemic and just the isolation
Girl,
and
I feel you, man. I feel you.
yeah.
Like I did the same thing. I gained like 10 pounds during like recently, and just I'll share with you what I've been doing that's been really helpful. Is I'm trying to treat like exercise and things like that as like a meal. You can't miss a
hmm
meal, right? And so I'm like, okay, exercise is just as important as what I'm eating. And so I found this really great thing, and no one's paying me to say this. I wish they would pay me, but there's a thing on YouTube called Fitness Blender, and I've been doing that for the past 2 weeks every day except for one day so far, and I really love it. It's free. They have ads, but they have it's strength training and stuff. And then in addition to that, I've been going for walks every other day or so, 30-minute walks. And my oncologist says that that can reduce your risk by up to 50%. It's just
Hmm.
just walking 30 minutes a day, and I was like, "Dang." So I'm trying to do that. But I was curious the different types of things that they mentioned because 2 years out, I'm sure that you're still you're still really hyper aware of your situation, and you're like, hey, I've got to really be on top of that stuff. And so I was curious if she gave you some advice for that, because I mean, if you're like me, you're kind of like a control freak where you're like, I want to do everything I can to try to keep myself safe and reduce my risk.
Yeah. I mean, that is basically the only thing they've really mentioned, and it's also been the most challenging thing for me.
Absolutely. I
Just
know. I totally feel you, man. I totally feel you. Yeah. I will say that and I'm saying this not just for your benefit, for those watching. There's a playlist on our YouTube channel for Dr. Joyce O'Shaughnessy, and she actually goes through and talks about a lot of things that can help reduce recurrence. Like you said, exercise, maintaining a healthy body weight, low alcohol, and low fat diet. Those are the four things that she mentions, especially triple negative. You and me, have to watch out for that stuff and be really on the ball. So when you mentioned the Taxol, you said that the thing that caused you the most grief was the neuropathy. That was the thing that really made it much worse for you than adriamycin cytoxin. Is that right?
yeah, and it was the only one that actually made me nauseous too. And like I'm not somebody who normally like barfs a lot, but
Oh
after
no.
Taxol, I
Yeah.
was barfing at least twice a week.
Oh gosh, that's
And
awful.
and it still happens on occasion. And I've talked to a couple other friends who are cancer survivors that went through other types of cancer but had that same chemo, and they've experienced the same thing. Like it's like sometimes when you just get really upset or something,
Yeah.
you throw up, and it's like a new thing
Oh,
after
that's awful.
undergoing
That's an awful
chemo.
new bad thing. We don't like that. No, that
Don't like
sucks.
it.
Oh. Well, since I know we're at 8 o'clock right now, our time. What is that? 6 o'clock your time, so we're at the top of the hour. And but Helen, we got to let everybody know, how are you today? Where are you today?
I'm good. I think I'm, like anybody else right now, it's just challenging, not knowing kind of when we're going to get out of this pandemic. It's a little depressing and stuff, but I'm trying to move forward and try to get back to some of my creative pursuits and things. And, um, just trying to find a reason to look forward to, even if it's, something little to look forward to, like in the next couple weeks, like, oh, I have tickets to a show, or, oh, I've got, I took this writing class and I've got that to look forward to. So basically just, you know, taking little steps.
Yeah, no, that's really good. And I'm glad to hear you're doing well and that you're taking care of yourself. And especially with your anyone's mental health during the pandemic is so important to stay on top of that and do things that make you happy. And like you said, give you something to do. And you and I have talked a little bit about music and possibly doing some music things together. And I do these like video collaborations. I don't know if you have the ability to record audio at a studio there, where you could lay down some bass and we could do a collaboration of some kind. But I really want to do that someday. There's a lot of women out there that are wonderful musicians, but I would love to do it with breast cancer survivors. Like, us put together a breast cancer survivor band for the moment and
Oh
and
yeah,
and do some jams. So we'll have to talk more about that for sure.
sure.
And I gotta see here. I've got a lot of comments because when we had the blackout here for a miniature second, that was so crazy. I wish you could have seen it here. I was like, wow, this is nuts. Not everything went out. Some things stayed on, but all right, here we go. Looking here. There's a couple of comments that were directed to you. Grace says the port was the best thing ever. I think she's saying I had breast cancer 4 years ago with AC and Taxol. Now, after 18 months, metastasized to her lungs, and she has to have a second port with different chemo and immunotherapy. Keytruda since March, part of a clinical trial. Grace, we're sending you much love and prayers, girl, man. Hang in there. I hope you're part of the group. I think I recognize Grace from our group. So, Grace, be sure and join our breast cancer survivor community on Facebook. It's in the comments here. I'll go ahead and find it easily. Go. So it's pinned, and if you want to join our group, if you're not already in our group, please do join. And Gina, who is definitely in our group, Gina, she is a breast cancer survivor, and she says, "Thank you for sharing your story, Helen." And then we've got Lawrence in the house is watching. Hey, Lawrence, thanks for being here. Trish says that was great. Thank you for sharing your stories. Super cool. So, Helen, man, it seems like it's not enough time, which means we have to do this again in the future. So maybe you can come back
Okay.
next year. We'll hang out and pick up and just check in with you. And in fact, Helen, if you make a note, March 3rd is Triple Negative Breast Cancer Day, and we do our
Hmm.
triple negative breast cancer broadcast. I would love you to be a part of that broadcast. So ping me on Facebook Messenger and let's schedule that if you're available. I would love to have you on that show.
Okay, great.
Cool.
Sounds great.
Awesome, girl. Well, thank you so much for hanging out with us today, and I hope you have a wonderful holiday season and stay well, okay?
You too. Thank you.
Have a good one. All right,
Bye-bye.
guys, give it up for Helen. She's a rock star. Totally cool. Awesome to have her on the show.